Welcome to the CUGH webinar, Global Health Competency Toolkits, Launch and Updates. We'll be getting started in just a moment. Good morning, good afternoon, good evening, depending on what part of the world you're joining us from. I'm Dr. Jessica Evert, and it is my honor to moderate this webinar with a great lineup of panelists. The Consortium of Universities for Global Health, www.cugh.org, is bringing you this wonderful webinar, Global Health Competency Toolkits, second edition, Launch and Updates. I want to do a bit of housekeeping for those of you that are joining us live. We will be having a question, answer, and discussion period at the end of the presentations. In order to ask questions or to contribute to the discussion, please type them into the question box in your control panel. If you would do so, mention the university and geographic location you're coming from so we can understand the voices on the other end of the webinar. In addition, CUGH will be recording this webinar. It will be open access and available on their website shortly. So we invite you to distribute it to your colleagues, peers, students, and fellow faculty. Without further ado, I want to introduce you to our lineup of speakers today. First, we have Barb Astle. She is the Director of the Center of Equity and Global Engagement at Trinity Western University. She is also co-chair of CUGH's Competency Subcommittee, which lives under the Education Committee of the organization. We have Carlos Faerron Guzman, Academic Director for the Organization for Tropical Studies, coming to us from Costa Rica. We have Ayla Landry, who is the co-founder and CEO of Porches for Progress. And we have Lahoma Rumaki, who is Associate Professor at North Carolina Central University. I'm so grateful for all of you joining us today and for all of you in attendance. We look forward to a robust conversation. Briefly, I want to just lay some groundwork with regarding to what competencies are. Oftentimes, we use the term competency-based education without having a shared definition. So competency-based education has been increasing in popularity over the last decade. It's used in both the workplace and educational institutions to express a standard level of performance that can be assessed and measured if the competency is achieved or progress is achieved. One way I think about it is that these are learning objectives which are actionable or demonstrable. So it's really taking learning objectives to the next level. Competencies are often divided into knowledge, skills, and attitudes. Importantly, this is not some wish list or list of content area topics. Rather, again, this is an acceptable level of performance or skills needed to perform at a certain level or position. A list of competencies is not a curriculum, but it can be used to help facilitate curriculum building and being mapped to curriculum. So we're going to talk about some examples today of how that can be done. When it comes to competencies in global health education, this is in part reflective of progress in formalizing and building frameworks for global health, both as a field and as an educational pursuit. As we all know, global health is an exciting topic with increasing interest among students and young professionals, both in high, low, middle income countries worldwide. There's been rapid growth in academic and extracurricular programs in global health. While this is very exciting, it also has led to challenges because there is not necessarily standardized curriculum or agreed upon competencies. And so CUGH has been taking the lead across hundreds of universities with a variety of stakeholders to really support the development of competencies and ensure that these are agreed upon by stakeholders, both professional organizations, faculty, institutions, learners, and communities. type of profession has competencies. Many of times they have specific global health competencies. So when we look at health professions, for example, nursing has global health competencies, medicine has global health competencies, dentistry has global health competencies. But CUGH really wanted to walk the talk of interdisciplinary, interprofessional global health and go farther than just profession-specific competencies. And so they help support this effort through their competency subcommittee. This represents a broad range of stakeholders within and outside of the health professions and honors the definition published in The Lancet in 2009 by Jeff Copeland and colleagues that global health emphasizes transnational health issues, determinants, and solutions, and involves many disciplines within and beyond the health sciences, and promotes interdisciplinary collaboration. So CUGH wanted to ensure that we had educational tools that will allow us to have this key interprofessionalism, interdisciplinary approach, and go beyond the myopic lens of clinical practice, which sometimes dominates health conversations. We're going to talk more about articles that CUGH has supported. The seminal article in 2015 was in Annals of Global Health. There was a subsequent article that was related to CUGH as well as researchers from 8 countries to look at community perspectives on global health competencies from over 30 countries. Another data point to look at is what employers are calling on our trainees to have in regard to competency and skill sets. So this is a study that was championed by Sharon Rudy and looked at USAID contractors who had job applicants who had domestic experience, but now we're trying to move into an international realm. And what Sharon and her colleagues did was ask, what are the weaknesses that you are seeing when people are applying to positions and they've only had domestic experience and not necessarily international understanding or focus or breadth? And the number one weakness was understanding context and realities of global health. That was followed by personal skills such as flexibility, adaptability, and creativity, cultural sensitivity, cross-cultural communication, and knowledge of key players, systems, and processes. So employers and what they're looking for from our graduates can be a source of information and influence for the competencies we're teaching. I'm now going to turn the conversation over to Ayla Landry and Barb Astle to talk a bit more about the development of these interprofessional competencies and how the toolkit came to take shape in its first and second edition. Welcome, Barb and Ayla.
Thanks, Jess. What I'd like to start with is Ayla and I will first give a little bit of a brief historical background. Specifically, I want to point out regarding why the development of interprofessional competencies. And Jess has actually alluded to a little bit of this. So it's the why, and then what that led to in terms of the development of the first edition of the Competency Toolkit. And then Ayla will speak about the current work that we've been doing the past year, on updating the first edition to the second edition of the toolkit. Next slide. Jess has already shown briefly this particular article, and I think it's really, really important. This is really a seminal article that was published in 2015, and you can see in the Annals of Global Health, and it really describes the work of the CUGH Global Health Competency Subcommittee in the development of the interprofessional global health competencies. There are really 2 historically pivotal periods, and I want to draw your attention to 2008, when at the inaugural meeting of CUGH, there was a discussion about the rapid expansion, as alluded by Jess, of global health programs and a lack of standardized competencies and curricula to guide these programs. The next point is in 2015, during the CUGH annual conference, there was much discussion amongst members, and particularly the CUG Education Committee, garnering recommendations for what kinds of activities and programs that would address not only CUGH's mission and philosophical mission, as well as how we might look at developing something like looking at competencies. So the Educational Committee appointed the Global Health Competency Subcommittee with the intent to explore the need to identify broad global health core competencies applicable across disciplines. So why interprofessional? Well, over the past decade, as we've seen, this increase, and it's been alluded to by Jess, looking at global health competencies, specifically in medicine, nursing, and dentistry, but there was noted that global health problems require a broad range of participation by those in health-related disciplines and those in non-health professions. So the committee referred to the WHO, the World Health Report of 2006, Working Together for Health, which emphasizes the importance for various stakeholders across many disciplines and professions at the local, national, and global level to address the many complex health challenges. So it's important to note that the development of these interprofessional competencies are really what they are now is a guide for a broad range of educational programs and may be relevant to a variety of trainees and professionals. And I quote from this article, these competencies are intended to initiate discussion amongst diverse disciplines globally regarding the focus of effective global health education programs for different levels of trainees. So during 2013, 14, and 15, there was much work by this committee in working through the process of 4 phases, which are well described in this article, and it's on the CUGH website, and I would recommend that you could read that at your leisure about the methods. Next slide, please. This particular slide here is quite important because it refers to the 3rd phase of this group that was working on the development of the competencies. And as they were doing this, it became apparent that it was really important to have competency levels to reflect differences in the education and professional goals of the various trainees. If you look at your screen there, you'll see there's 4 specific levels. And the level 1 is called Global Citizen level. I'll just briefly read along with you. It's required for looking at all post-secondary students pursuing any field bearing on global health. Then level 2 is the exploratory level. And this is really focusing on as a requirement of students who are at an exploratory stage, considering future professional pursuits in global health. Level 3 is what we call the basic operational level. And this is required of students aiming to spend a moderate amount of time, but not necessarily their entire career, working in the field of global health. And we see that with many of our students. Then this was broken down into 2 very important subcategories: the practitioner-oriented operational level, and that really is more discipline specific, is what I would highlight there. And then the program-oriented operational level is really where it would be a set of required for all students in the realm of global health programs, which many of us are involved in. The final level, level 4, the advanced level, this can again be framed to be more discipline specific or tailored to the job or capacity with which one is working in. So in the end, this committee agreed to focus on 2 of the 4 levels, which is the global citizenship level and the program-oriented basic operational level, as these levels appeared more amenable to interprofessional competency development and could transcend disciplines. Next slide. In this particular slide, what I've got here, it's just shows in the end, the final list of 11 domains, which you can see in the legend below for the global citizenship level. There were a total of 8 domains, and I've listed the numbers there. So the domains on the left-hand side and at the bottom, they correspond with that, and 13 competencies. And for the program-oriented basic operational level, a total of 3 domains, which are 4, 9, and 11, with accompanying 39 competencies. And these domains, for your background, were adapted from the Association of Schools of Public Health, which has done quite a bit of work in the early part of this decade on competencies, as well as adapted from the work that has already been done on global health competencies in the disciplines of medicine and nursing. Next slide. This slide here is an example of what what was described in the article, and I'll describe here, is that these competencies from these two levels and accompanying competencies, so this is just one example of the first page, where they were divided up into under the domains, as you see on the left, domain 1, which is the global burden of disease, and then accompanying to that would be the appropriate level using categorizing them by using Bloom's taxonomy, which were the knowledge, attitudes, and skills. And this is really, really helpful to break it down. So you can see that we've got the levels and the domains, but actually the competencies in terms of categorizing that is really helpful when someone is working on their development of the curriculum and what the objectives, accompanying objectives for that might be for them. So from here, the subcommittee worked collaboratively, taking a lot of this work over the last couple of years, following the publication of that, and developing a toolkit. And what was really quite remarkable about this is many of the members on the subcommittee, as well as others interested in the work of competencies, we call them contributing scholars, took various domains and worked in groups and populated these domains and competencies with a variety of resources. And Carlo is going to demonstrate what a little bit more when he speaks about how that looks. And so this then competency toolkit, we call it a living document. So it became quite a useful resource in the end. We uploaded it on the CUGH website, and this is something I know I've used, and many other people have looked at the various resources. So it was very useful to have these competencies, but how they might align with your particular global health program in your curriculum that you have been developing. And so it's also important that we continue the dialogue about the uptake of these competencies, because there's certainly much more work to be done, and we'll have more conversation about that at the end of this presentation. So now I will switch over to Ayla so she can talk about the continuing work we've been doing from taking the first edition of the toolkit and updating it. Thank you.
Excellent. Thanks, Barb. So this is Ayla Landry, and I'm a global public health nurse, and it's been a joy to work on this CUGH Competency Subcommittee, which is a subcommittee of the Education Committee. And this year, with Barb as co-chair, we've developed several different task forces within our committee to work on different goals to address global health competencies. As Jess mentioned, there's a variety of different ways that this is being pursued, and we're excited to take part in that. Specifically for the toolkit, we have a toolkit task force, and the members of that task force are all of us presenting to you today. So there are 5 members of our toolkit task force that really took on the goal of updating and improving the toolkit. So what I mean by updating, clearly a document that's published is there's going to be new resources and new content and new research and new strategies that are developed over time. And we want to make sure that the document is a living document that changes over time and improves as global health practice and education is changing. So we wanted to update it from a content and quality of content standpoint. But our toolkit task force also looked at the first edition and realized it is an amazing resource, but it is quite a lot of information and a lot of different types of resources for different disciplines and different levels all mixed in. And so another part that we really wanted to do was improve the toolkit for use, more friendly use for those people that are downloading it and using it. And we hope those numbers are going to be improving as the document improves. So how did we go about taking on this goal of updating the content and improving the use of the toolkit? Well, we started out with a lot of collaboration from the contributors. Our first step, we have had regular meetings throughout the year, and early on we wanted to make sure that we gave the opportunity to the original authors of each competency to update their own content, as these were their areas of expertise.
And so we reached out, and when the previous original authors of the toolkit from the first edition were available and able to update their content, we utilized them for the update. And if someone was not available, we were excited to reach out to additional contributing scholars with expertise in the different competency areas from within the CUGH network. And then we also encouraged those within the CUGH network to pass the opportunity along to colleagues that had some expertise in the particular areas that didn't have a claimed author updater for the second edition. So once we had all of those contributors gathered, each of us on the toolkit task force took our part in managing and making sure that we were available for those contributors to answer any questions, because we did make a few changes that I'll be highlighting as I keep going, but we wanted each contributing author scholar to not only update the resources with any new content, research, teaching strategies, but one of the things that we thought would really help with use of the toolkit was to have some sort of annotation or summary underneath the resources that were provided. So Carlos is going to be going after me and giving you a brief sneak peek at the toolkit to see what this looks like in action. But we wanted to show, if somebody has a video underneath, let's say, the one competency, then there would be a little blurb underneath that explains what the video includes, and that, therefore, if someone's looking through the video options, and luckily there are so many resources available, you could select one based on some of those annotations and summaries. So we made sure we were available for the scholars to update their content and their annotations. And then once we received those back, another thing that we wanted to do to assure quality of the content that we were going to be including was to have peer reviewers. So once we received those competency updates from the first scholar updating them, we then sent it on to another scholar who also has expertise in that area or has expertise in education to review the competencies again for that content, have a second set of eyes look at it to see if there are any other new resources. We wanted to have a diverse set of eyes working on it for that interdisciplinary piece and just the wealth of information that you get when you really put a group of scholars collaborating together. So we had peer reviewers look at it. And then once we received those peer review competencies back, then ourselves as the Toolkit Task Force did a third look at the competencies that we received to do a final editing process to make sure that we had, a quality content to pass on to all of you. So that was the piece that we did from contributing the scholars. And then if you want to go to the next slide here, I'm going to highlight some of the things that we did new in this edition. I mentioned the peer review content and the summaries and annotations for the listed resources, which again, I think will really help with the quality and the use of the document. But we also included some interactive navigation features. We have, really great table of contents this time included that's broken up by the domains. So you can see for the first domain, which is global burden of disease, you'll be able to see, okay, if I'm looking for something in that particular domain, I can go right to this section. And not only that, you see the competencies listed under there. And Carlos is going to do a great job showing you the interactive features to be able to navigate that content. And then from there, also being able to navigate, do you want a video? Do you want an article? Are you wanting, research or just a different sort of resource available? And we have those divided up in the document as well. And finally, we wanted to put some professional finishes on the document to make sure that it looked uniform in its formatting and really could be a finished out document for easy use. So it is a living document. We absolutely see it that way. There's so much work to be done and it's exciting work, research and evaluation to make sure that this resource continues to be something of value to an interdisciplinary global health educators and practitioners around the world. And there's a lot to be done. And so put a little plug in here for our our committee, if you're interested in this work or you are doing work on this, keep an eye out. After we launch the toolkit, we'll also be launching some surveys and some other ways to get involved and help keep this document living and living well as we continue to improve it from a use and a quality standpoint. So that's what I have. Carlos will show you some of these new features that we have. Pretty exciting.
Thank you so much, Ayla. That was wonderful. And Barb. So I'm going to go to Carlos now, who's going to share in real time the toolkit and show you how to navigate and all the wonderful resources you're going to find. Welcome, Carlos.
Hi, thanks, Jess. Hi, how's everyone going? Hope everyone's doing fine. What you're seeing here in your screen is actually the actual toolkit, so the actual cover page of the toolkit. And what we wanted to do right now, and I want to walk you through, is what the toolkit actually looks like and how you'll be able to use it when you're consulting it and want to work with it. So I'll just run you down to the, I'm going to hide this right here. I'm just going to run you down to the table of contents. So what we tried to do with the table of contents, and this will be a document that it's meant to be used in a digital platform. That means from your computer, from your PC, not in a printed fashion, because it works through the different links and hyperlinks that the document is full of. So the table of contents that you're seeing here, as you can see, the domains are listed, and what they do is that they mirror the seminal article that Barb was mentioning you early. So if you look at that seminal article, I'm just going to navigate to the top here so you can see that it's the same one. When you look at this article, what it'll show you is the actual competencies by domain, and it lists them 1A, 1B, 1C, etc. So when you look at the toolkit, that is exactly what the toolkit is. The table of contents is an exact mirror of that. So the actual toolkit has a structure that repeats itself throughout the document, and I just want to run you through an example. So when you look at domain A, domain 1, which is the global burden of disease, the toolkit will tell you what that domain means, and then in the next pages, what you'll see is the actual competencies. So let's say use the example for competency 1A. It describes what the competency is. So competency 1A is describe the major causes of morbidity and mortality around the world and how the risk of diseases varies with regions. So if you're interested in this competency, you go from the table of contents, and then you navigate to it, and all the competencies are going to have this structure. They're going to have the number of the competency, and then what they're going to have is who prepared them in their first edition, and then who prepared it in its second edition. And what you'll find is the name of the person, in this case, competency 1A was Ayla Landry, where they work, and what their email is. And this is very important because what we wanted to do is make, as Ayla was saying, is make this as a living document as possible and make the collaborators accessible. And so you can provide feedback, new resources, etc. So you'll have the competency, you'll have who prepared it. You also have a basic rundown on what the teaching strategy is. So if you're trying to create a program, a course, a workshop, when you're trying to focus on this competency in, let's say, 1A, the teaching strategy will give you kind of an overall strategy of what you should be focusing on. And then below that, what you'll have is these kind of links to the different resources that you'll be able to access. Now, not all competencies have all the resources available. As you can see, competency 1A in this case doesn't have videos, but it does have websites and article and reports. So if I just click on websites, it's going to take me to the list of websites. So what you'll see here is, okay, competency for 1A, the website is American Interprofessional Health Collaborative, and then it gives you it'll give you a small summary or annotation, as Ayla was saying, about it. Okay, so I'm going to run you through a real example, and we're just going to scroll up and go to our table of contents where we started. I'm sorry. And then say you're interested in this domain, collaboration, partnering, and communication. and you want to go to that domain and you're interested in, let's say, competency 5B. Okay, so competency 5B states demonstrate diplomacy and build trust with community partners. And as I say, this table of contents in the top, it'll be your navigation panel. It'll be from where you access all the resources. So you're interested in competency 5B because you're teaching a class, or you're running a workshop, or you're taking a group down to Costa Rica, let's say, and then you want your students to be able to demonstrate that diplomacy. So you click on it, and it immediately takes you to the competency. So it's easy to find, it's easy to navigate, and it repeats what the competency is. And then the next immediate page is the actual, like I said, the competency, the teaching strategies, and the different resources that you'll be able to access. So let's put this to the test. And I'm looking for literature that I want the students to use for this competency, or that I want to use for to build my classroom. So I go to article and reports, and it'll give me the actual article and reports listed alphabetically. And like Ayla was saying, it'll give you this short summary, so you're not clicking in and out of each content and reading through all of them. It'll allow you to just say, oh, this seems like this is what I'm looking for. So if we put this to the test, let's try to test whichever. Let's rate this one from Keynes, and I just click on it. Now PDF is going to tell me. It'll take me to the actual link to access. Now, be warned, not all links are going to take you to PDFs. Some links will take you to websites where you need to access those through your university platform libraries. But most links will lead you easily to where you want to go. So we just go back to the toolkit. You can do that also with any of the other competencies, and so it's easily navigated. You can navigate it easily. I just want to run you through another example. Let's say you're interested in competency 7A, demonstrate integrity, regard, and respect for others. You do exactly the same thing. In this case, you're interested in videos, which you haven't seen an example, but the same way, it just shows you the name of the video, and all links have been double checked. So let's put that to the test right now. All links have been double checked, so you should be able to be seeing them all accordingly. So with that, I hope that with these kind of changes that we've made with the toolkit, what we're hoping is that it becomes much more user friendly, is what we were aiming for. So I'm going to pass it back to Jess, and I'll happy to take some questions at the end. I'm going to stop sharing my screen.
Thanks, Carlos. Wonderful. Let me just get here. All right. So thank you for walking us through that. It's a beautiful document, and as everyone can see, the information is rich and deep, and also connecting you with the folks who contributed, so you can ask them questions directly, which is great transparency. We're going to move to Lahoma, who's going to share with us how she has utilized the competencies for course development. Welcome, Lahoma.
Thanks, Jess, and hello, everyone. My name is Lahoma Rumaki, and I am a professor of public health. One of the ways that one of the reasons that I really am excited about this project is because it helps me as an instructor with new ideas to cover, material that is really challenging. I will be using this toolkit as I develop my course next semester for a group of 25 undergraduates from various disciplines. So this is an introductory course. Students from disciplines as diverse as business or pre-law. The pre-med students are nursing students, and I even have a few arts students who will be taking the class next semester. So the challenge, of course, when you have students who come from a variety of backgrounds and interests, the challenge is that the material will be relevant for them, but also keep their interest. And I think that the toolkit provides a lot of great ideas to help you do that. So what you see in front of you now is a sample lesson plan taken from that first competency, Competency 1A, which says that you're going to describe the major causes of morbidity and mortality around the world and how the risk of disease varies with regions. Now, next slide. You'll see that the competency can be looked at from various levels, the global citizen level or the exploratory and basic operations level. Barb explained those to you earlier in our presentation. The course that I am developing will be targeting that global citizen level. That is those students who will be looking at this for the very first time, and we really want to just provide them with information that will help them to be more globally aware. Again, and as I said, the challenge is that I'll be working with students from various backgrounds, so they're all not public health bound or global health careers bound, but they still need this introduction to the material. So based on the materials from the toolkit, I have designed these objectives that by the end of this class, students should be able to increase the capacity to describe the burden of disease between and within countries, to discuss risk factors for various health conditions, and to describe the changing patterns of disease that we talk about in terms of demographic and epidemiological transitions. Next slide, please. So the way I approach this material is to first define those key terms that you saw on the very first page. And we will focus on the key terms of morbidity and mortality. And then I will compare and contrast these measures from the perspectives of different countries by identifying risk factors that place each of these different groups at risk. Important for me is to make sure that we don't focus on any one particular country, but to allow the students to increase their knowledge about how all of these groups exist and may suffer from various risk factors regardless of where they are. So even though we will look at region and country, the focus on the groups and to help from a global health perspective, the students understand some of the challenges that we face regardless of region or country, and to heighten their awareness of those issues. And the last slide, please. And one of the ways that I think that it's really important is to have students kind of engage in discussions. So I will have lots of discussion activities and use some of the materials that Carlos outlined for you in terms of the videos or the websites. This particular discussion will focus on risk factors for refugees. And the question is that although we have examined the conditions and risk factors for people living in other countries, I really want them to understand what the challenges are for people living here in the United States. And I think that the toolkit provides a wealth of material, and as Ayla said earlier, there's a lot of content, but if you take the opportunity to look at the specific knowledge, and in this case, the knowledge that you want to convey on this competency, the toolkit provides lots of examples to help you do that. Thank you.
Thank you so much, Lahoma, for putting that in context for us. I'm going to just bring up a point that Quentin Eichbaum has really led the charge on, which is some of the critiques around competencies in general. We are not going to go in depth with this, but I feel like we would be remiss if we don't mention that there are some controversies and some potential issues with competencies. So one of the potential issues is that the input into what competencies are desirable has been in some ways based on the input from the global north. So the initial 2015 article reviewed, I believe, 24 competency sets, many of which stem from the Global North or organizations that are dominated by the Global North. And I use Global North as a synonym for high-income countries. However, that subsequent study where the researchers came from 8 countries and the respondents came from 30 countries helped to diversify the input in this way. And some of the take-home from that study was really that partners in the Global South felt like students needed to really learn about humility, their own limitations, as well as working within teams and maintaining respect for local populations. Also, there's insufficient context specificity of some of the competencies, and we're going to talk more about that. Quentin also emphasizes the unresolved kind of individualistic versus collectivist disjointedness, because some cultures which are collectivist are not going to think about competency or even professional activities in the same way that individualist cultures do. Many of us as educators are coming from more individualist cultures, and so just recognizing these limitations. In addition, there are challenges around assessment methods, and we can talk more about that during the discussion. Quentin goes on to describe context-free competencies, so generally competencies that a person can have that would be semi-consistent, that regardless of what context they're in, versus context-linked, where practitioners really need to have deep understanding of the context to actually have competency. And since global health is a discipline where often people are working outside their usual frame of reference, whether it's in their own backyard where health disparities exist, or it's across the world where health disparities exist, the fact that learners may be competent in one context but not another needs to be recognized by educators and purposefully dealt with in our programming. Quentin goes on to describe what he calls acquired competency and participatory competency. So he gives an example from human health, but you could look at the same examples from animal or plant, environmental health. But some sort of acquired competency would be knowledge or skills that are, I would say, fairly objective, that regardless of where you go, the anatomy of the eye is going to be similar for humans, or the anatomy of the eye is going to be similar for cows or dogs, etc. However, participatory competencies are those that really have an overlay of interprofessional or interpersonal communication, contextual understanding. So while the eye may be a similar anatomy wherever you go, how you convey to a patient about disease of the eye, or understanding how those diseases are perceived, or the way that patients, families, or others are thinking about them, is very much participatory and context linked. So you may have amazing understanding of the anatomy of the eye, but that does not necessarily mean a learner can translate that understanding into professional practice in different contexts. Another example that Quentin uses is, a context-free competency may be interpreting viral loads and understanding what diseases a patient with a certain viral load is at risk for, versus counseling a patient who's dying of HIV is going to be very context-specific. Counseling that dying patient depends on where the patient's located, what the faith and the community context is, the people who are around the patient, how dying is discussed in a specific context, language, etc. So just to point out that these are some of the critiques that come along with competency-based education. Now we are going to move into the question and answer segment. I'm excited because there's a lot of exciting questions. One of the things that's come up from multiple listeners is when and where is the toolkit available? The toolkit is going to be available in the next 6 to 8 weeks, we estimate. It will be available on CUGH's website for a free download and use. We will also be proactively emailing it to everyone who registered for this webinar. So if you're on this webinar and asking this question, it is going to be in your inbox, and so look for it there. I'm going to invite all my panelists to come back. The first question I'm going to take is from Ron Coos, who asked, whose comments, "This is a very complete and living document, certainly showing the committee is very competent." And the question that he has is, did CUGH require people to have greater than 5 years of embedded experience in LMICs in order to sit on the committee or contribute? Ron, so there is no requirement for anyone being embedded for any amount of time in LMIC or any other setting. I think this is in part reflects kind of the non-geocentric definition of global health, that global health is, in Central Valley of California just as much as it is in Namibia. And so people come to CUGH sitting on committees with a variety of different experiences in global health. Some are local, some are global, some are in emerging economies. And so there's no requirement with regard to that. The next question I would like Carlos to maybe take a stab at, and then anyone else who would like to do so. So the comment comes from, and question comes from Ayat Bashad, and he says, "The toolkit seems focused on public health from a quick skimming. Was a One Health approach considered when creating any of these competencies to really integrate a multidisciplinary global health approach?" Ayat is a master's student at the University of Edinburgh. Carlos is also a leader and expert in the One Health movement and looking at the intersections of environmental, human, and animal health, just for anyone who is less familiar with One Health approach. Planetary health is also another movement that is trying to honor the connection between environmental, human, and animal health. Carlos, could you comment on the relevancy in that regard?
Sure. Thanks for your question. It's a very interesting one, actually. To be blunt, when these competencies were created, the framework of One Health, planetary health, eco health was not necessarily integrated into the competency list. So what you'll see is mostly that the competencies respond to a more traditional, let's call it like that, traditional global health perspective that very much responds to a public health approach. Nonetheless, these competencies are not to be taken as a rule book. They're meant to be taken as a guide, and flexibility is available in these tools and in these resources. So let's say with competency 1A or domain 1, you're understanding the burden of disease. You can understand burden of disease from a traditional public health approach, or you yourself can take that competency and see what other lenses you can apply to that competency and be efficient at teaching that through a One Health, planetary health approach. So just to summarize, we didn't specifically look at these through these planetary One Health lenses. However, there's flexibility and there's space for innovation. But thank you so much for your question. I hope I answered it.
Thank you, Carlos. Gurpreet Rana comes to us with a question. Were global health librarians and informationists involved in the curation of the resources? Anyone who wants to take that question?
This is Ayla Landry, and I think not specifically. We reached out to the a lot of contributing scholars within CUGH to look for people to contribute. We want to be as inclusive as possible, so certainly we weren't intentionally excluding any librarians there. Certainly quite a few researchers were involved in contributing to the competencies in the second edition, but we definitely acknowledge a need to have more interdisciplinary contributors and to be constantly looking at that diversity of contributors to provide the most rich information and content moving forward. So I don't think there was anyone specifically in this second edition that I can think of that would categorize or identify as a global health librarian. However, we certainly are open to that and want to be as inclusive moving forward, and that's certainly an area to continue to evaluate.
Great, thank you so much, Ayla. So Michael started off about work to address other levels of the competency. So the initial article in 2015 laid out the global citizen level, which is proposed for all post-secondary students, and then the basic operational level program focus. Barb, I wonder if you might just briefly talk about the work, the basic operational professional focus, because that's really where we get into some of the discipline specific. And then I'm also happy to speak to some of the other levels, and anyone who is working on other levels of competencies, please contribute.
Thank you for that question. That's an excellent question because there's so much work that is yet to be done, but I can speak a little bit about that practitioner-oriented operational level because that is something that my background is nursing, and I have completed a study actually on competencies used in nursing, and that publication will be out shortly. That talks about things that are actually discipline specific. So I think it's really important when this initial work was done, as Jess has said in the group, was looking at what was more amenable to interprofessionals. But we're not blind to the fact that when this work was being done, that there were other things that would be more specific to discipline specific. And so those competencies, so some of us are researching in nursing, like I said, continue in dentistry, and putting some of that work together to demonstrate that there might be some things that while they cross over interprofessionally, that there are things that might be specific for our discipline. And I'm just hesitant to give all of that information out at the moment until I check with my authors and have it out in publication. But just to let you know, that work is being done. And when you think about some of the other disciplines that are out there, on our subcommittee, we have someone from engineering. And so these are other engineering, and I'm just trying to think, I think we have an anthropologist, and we also have people from broad disciplines, but also in other parts of the world globally. So this is an area that does require continued work, and it's one of the areas that this subcommittee will continue. We'll not only look at what we've got there, but looking at what the other disciplines are doing. And then there's this level 4 I want to bring to your attention, being the advanced level. And this is even tailored to more what your job is. And so when we think about some of the disjunctures and things that Quentin Eckenbaum has talked about, this is actually really important work as well to look at, depending on what context you're in. And what discipline you're in, you may have some other competencies that are required. So this is actually quite exciting work that is being done by various scholars, and more. And one of the things, one of our goals in this committee as well is to garner the work that various people are doing on competencies, and that is in the works at this time. So hopefully we'll have more resources there so you can see what other disciplines are doing in terms of looking specifically at competencies. I also wanted just to mention one other thing about the One Health, planetary health. Very, very important areas. And I think Carlos did an excellent point of speaking about how these competencies were developed. And when you think about planetary and One Health, this has all been emerging during that time. And so I could see that as we work and have others collaborate with us, that there'll be more inclusion of some of these other competencies that may be really useful in working in those other areas. Jess, did you have anything else you'd like to add? I was just thinking about our host competencies, but you did mention that. But some other work in medicine?
Yeah, just that there are efforts working across particularly the field of international education and community engagement to define the competencies for the exploratory level, which are really, what are the pre-departure competencies for learners who are going to have an experiential learning in country or in their own backyard in a community that is different than their frame of reference and often marginalized, disempowered, or otherwise vulnerable. So just to point that out. The next question comes from Erica Torres, and Erica was actually a a contributor to the original competencies. And she's asking, it's been 4 years since we published almost 4 years since we published the 2015 article. Are there any plans for revising CUGH's interprofessional competencies? I would say that the committee right now is not looking at doing a full revision, but I think that there may be momentum, particularly with, what we're talking about, the planetary and One Health, that the original article does fall short with bringing that more holistic viewpoint of health, particularly environmental and animal health, because the article was really mostly written by people who interact with human health or human infrastructure. Does anyone want to comment on kind of thoughts on revisions necessary for the CUGH interprofessional competencies themselves, which the toolkit is based on?
Ayla, and I just wanted to add, not particularly on the article, but I think a big part of the work that our competency subcommittee is going to be doing is trying to gather the feedback from the toolkit and its use through surveys and feedback that we get from you all. And so I think through that, if we do see trends and things, I imagine that feedback is not going to, there'll be yield from that and changes that are made to the toolkit based on the feedback that we receive. So I don't know in terms of the changes to the article and to CUGH's domains and competency lists, but I think we certainly are going to be working on updating the toolkit, and I imagine there will be a lot of changes coming down that we had mentioned and have yet to even discover based on the feedback that we do get. So participation in that and feedback that you all can provide will be really helpful. I think the more voices we have, the better.
And
Yeah,
just to add,
go ahead, Carlos. It was Barb, but you go ahead.
Oh, thanks, Barb. I just want to kind of highlight how important it is that we receive the feedback from the people, practitioners on the ground, basically because when we are, if we're going to do a revision, this needs to be based on what are people needing, that these global health practitioners that are graduating, that are learning these competencies, skills, attitudes, and knowledges, what they're doing, how can we then understand? And then just another a point to be made is that the Planetary Health Alliance is asking the same questions around competency. So they're trying to understand, and this relates to what Jess and the question from the audience was. We're trying to understand how we can best merge efforts instead of finding parallel efforts in competency development. So you might see a little bit of that in the future, although nothing is yet fixed in the agenda.
And Barb, did you have a comment?
Yeah, and that's sort of supporting what my colleague said there, is that one of the things is we really, the input, it's a living document, it's so valuable, and I know others are doing this. So the next stage is to really see how it's being used, get some of this feedback. We want to do a little bit of research, and then yes, there'll be some, I know there'll be some updates and other changes with this document as we go. So that's the exciting part of it, I think, is global health is evolving, emerging, and the inclusion of these other disciplines and ideas. And just like what you said, Carlos, I was going to kind of mention, because we talked about that planetary health a while ago. So I would say any of you, just stay tuned, and we've got lots of work ahead of us, but very exciting. And this committee is one way of continuing this very important work. Thanks.
Great. And Cinematore Felix brings to us a question regarding evaluation, and we only have another minute or so, so I just want to quickly mention assessment and evaluation, because that is such a big piece of this. If we have wonderful ideals about how our learners will develop, but we don't have assessment or evaluation tools, we're falling short. So I'll just point out a couple of things. The AAC&U has a values rubric, which is open access, and that is for global learning and has great kind of different levels of proficiency, and it breaks it down in a way that is helpful for assessment. In addition, we know that competencies, again, the difference between competencies and learning objectives is that competencies have to be demonstrable. And in global health, when you're talking about demonstrable in context, either in your own backyard or across the world, that are different from often your institution or your learner's frame of reference, having really strong partnerships and relationships to allow a 360 evaluation of the learner and how they're performing, how are they dealing with stress, how are they being respectful or not, collaborative or not, etc. That is so important, and that's where some of the uniqueness comes in, because we can do objective testing, and that's one piece of it, but we also have to have the ability and the relationships to really get a 360 perspective of our learners in experiential settings, as well as self-reflection and critical reflection is increasingly being used as an assessment tool, and there's research on that you can look up on PubMed, how to use reflection as an assessment tool, how to code reflection, and to measure, actually quantify learner development through that. So those are a couple of ways to think about assessment. Does anyone, we have about 10 seconds more, does anyone have any other ideas on assessment they want to put forward?
This is Ayla. I was going to jump in and really strongly suggest we didn't take out specifically from the teaching strategies suggested for each competency what the assessment is. However, a lot of the contributors did include suggestions for assessment in their teaching strategies, brief explanation at the beginning. So I would say check that out as you're looking in the toolkit.
Great. And Cynthia Stuhlmiller from University of Buffalo last week or 2 weeks ago in Global Health Science and Practice published a self-assessment tool that's based on the competencies that she's validated in nursing students. So you can look up Cynthia's work as well. We're going to be signing off. I want to remind you that the toolkit will be available in late November, early December. Everyone who is registered and attending this webinar will get the toolkit emailed to them. It will also be posted on CUGH's website. In addition, the slides, many of you have asked about the slides. They will be available for download on the CUGH website. So please visit www.cugh.org. Go to events, past events, and you will find this webinar living there. We're so grateful for your time and attention today. Thank you to Barb, Carlos, Ayla, and Lahoma for your rich contributions. Everyone take good care, and please look also at the CUGH annual conference, which will be coming up in 2019, March 2019 in Chicago. We hope to see you all there. Thank you, and take care.